Okay, we're wrapping up the autonomic nervous system, at least for this class. So let's do a little bit of a review because we were just talking about adrenergic and cholinergic and sympathetic and parasympathetic. So the sympathetic nervous system, that's fight or flight. The sympathetic nervous system uses adrenaline. The modern name for adrenaline is epinephrine and norepinephrine. And those receptors are called adrenergic receptors because adrenaline, right? For the parasympathetic nervous system, that's rest and digest. And the parasympathetic nervous system, its dominant neurotransmitter is acetylcholine, which is why the receptors on those cells are known as cholinergic receptors because they receive acetylcholine. Quickly, let's review the most important adrenergic receptors: alpha 1, beta 1, beta 2. Alpha 1 receptors, when they are activated, they will cause smooth muscle cells to contract. And that in particular, we're thinking that it will cause blood vessels to get smaller in diameter in some areas, not everywhere. But the blood vessels to the intestinal tract, they will get smaller, so less blood goes to your digestive system, so more of it will go to your muscles and your brain, okay? Also, it's alpha 1 receptors that will cause a person's face to go green when they are frightened or get really bad news because the blood vessels close off and no bright red blood goes to your skin. And without that, we look a little bit green, right? Beta 1. I remember beta 1. I always think to myself, heart, lungs, beta 1, beta 2. So beta 1, those receptors are found on the heart, and they will, when they're activated, will make the heart beat faster and make the heart beat harder. Beta 2 receptors, they're found in a few areas. When they're activated, they cause smooth muscle to relax. Now, when you're fighting a saber-toothed tiger or whatever, what would be useful to have smooth muscle relax? Well, I'd like to be able to get big gulps of air into my lungs, right? So the smooth muscle that wraps around my airways, when beta 2 receptors are activated by the attachment of adrenaline, they will relax the smooth muscle. So on your lungs, you'll get big gulps of air. The smooth muscle will also be relaxed by beta 2 receptors to skeletal muscle, so that more blood goes there. Less blood to your skin, more blood to your lungs. Alrighty, now we're talking about cholinergic receptors. And there are two main types for you to know: nicotinic and muscarinic. Nicotinic and muscarinic, they got their names differently. They got their names for where these two poisons will bind. Nicotine will bind to nicotinic receptors, and one of the poisons found in mushrooms will bind to the muscarinic receptors. It's kind of good to know that the nicotinic receptors, N1, N2 for nicotinic 1, nicotinic 2, it's kind of good to know that they will bind nicotine, because periodically you will find little kids that will be accidentally poisoned with like the nicotine from a vape pen, or the nicotine that's in, when people are trying to stop smoking, they chew nicotine gum. Sometimes little kids will chew a bunch of nicotine gum and they'll get a nicotine poisoning, and you can explain it by binding to the nicotinic receptors of the autonomic nervous system. All right, so N1 for skeletal muscle, N2 for post-ganglionic neurons. Okay, let's start with skeletal muscle. You might be saying to yourself, skeletal muscle, that's not part of the autonomic nervous system, Tidal, and you are right, it is not. However, the motor neuron that commands a muscle to contract, it releases acetylcholine from its axon terminus, and when the acetylcholine is in there and it binds to a receptor on the muscle side, It is a cholinergic receptor because it binds acetylcholine and it falls into the category of N1. N1 receptors are always excitatory, so they will always lead to an action potential happening in that receiving cell. So when N1 receptors are activated on the muscle, on skeletal muscle, it will cause skeletal muscle to contract, right? N2 receptors, post-ganglionic neurons. Let me see if I've got a picture here. So remember that in the autonomic nervous system, like here's going to be the CNS, there's always two neurons in a chain. That's one of the ways it's different from motor, right? That's true whether it's parasympathetic or sympathetic. There's always two neurons in the chain. The first one is the pre-ganglionic neuron because it's before the ganglion. And this one is the post-ganglionic neuron, post-ganglionic, because it's after the neuron, okay? So the nicotinic receptor that is found on the post-ganglionic neuron is an N2 receptor, The N2 receptor is found on the post-ganglionic cells of the parasympathetic nervous system. That's cool. We're expecting that because they are cholinergic receptors. What you may not expect, which is why it's like always on exams, is it's also on the post-ganglionic cell of the sympathetic nervous system, okay? So where is one place in the sympathetic nervous system where you will find a cholinergic receptor post-ganglionic cell? Muscarinic receptors. The muscarinic receptors are found in multiple areas. Like they're found in the digestive tract, for example, right? Rest and digest. But the one place I need you to know about, because we're going to be starting to talk about the heart, is that muscarinic receptors are found on the heart. And I don't need to know their numbers for my class, but the muscarinic receptors are found on the SA node and the AV node. And when they are activated, they will cause the heart rate to slow down. Ready? So what will happen if you give a patient a nicotinic 1 antagonist, an N1 antagonist? Let's break it down. An antagonist will bind but prevent the activation of that receptor. Where do we find N1? We find N1 on skeletal muscle. So if I give my patient an N1 antagonist, it will bind to skeletal muscle cell receptors, and it will keep the cell from being able to contract. So I will get muscle paralysis. There you go. What if I had M2 receptor antagonist? Okay. The M2 receptor, that's the one that's found on the heart, right? And the M2 receptor normally would slow the heart. If I give the patient an M2 receptor antagonist, I might expect the heart to speed up in heart rate, okay? On the other hand, if I gave the patient an M2 receptor agonist, I would slow down the heart, right? Remember, with 151, with medicine in general, it is super hard to memorize all of it. So the more the stories kind of make sense to you, the more you can think them through in an exam or a critical situation and come up with the right answer. All right, so the cholinergic receptors on the heart are found at the SA node and at the AV node. So the cholinergic receptors, and we're thinking particularly M2, they will slow the heart rate. Now, there are also adrenergic receptors on the heart. Remember, we were thinking heart, lungs. So beta 1 receptors are found on the SA node. They're found at the SA node and the AV node as well. And they cause the heart rate to speed up, right? The thing that's different about the sympathetic and parasympathetic nervous system when it comes to the heart is that the sympathetic nervous system can make the heart beat harder as well as beating faster. What does it mean when the heart beats harder? Well, we'll be talking about that because we're going to be talking about the cardiovascular system. But, sometimes your heart's beating fast, but sometimes your heart's beating slow, but it's going ba-boom, ba-boom, and you can feel it in your chest. It feels really weird. Well, that would be because the heart's beating harder. So on this particular diagram, you'll see the green nerves that are going towards the central nervous system. Those are sensory neurons that are reporting, well, what is the blood pressure and what is the amount of CO2 in the blood, right? And they are talking to the heart about that. And then talking to the central nervous system about that. And then the central nervous system will make a decision. Should I put my foot on the brake and slow down the heart? Or that would be parasympathetic and cholinergic. Or should I put my foot on the gas and speed up the heart? And that would be sympathetic stimulation. All right, we're going on to senses next.